Now, this advice is for absolutely every single pregnant patient, and it doesn't have to do with position. It has nothing to do with your pelvis. Oh, I love my crocheted pelvis. It is the most important advice that you are going to get going into your delivery. And in case you follow all the pregnancy people on social media, you'll get their most important advice all the time. I guess mine might be kick counts because you hear me talking about that a lot. By the way, if you want to learn how to do kick counts correctly, I have a whole cheat sheet down below. But make sure that you're learning about birth and how to look at your birth from an expert. In case we haven't met yet, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I have seen so many people go through labor, including myself 3 times, including lots of friends, and I think this advice applies to everyone, so I'm so glad that you're here. Now, what is the advice? Drum roll, please. Be flexible. I know you're like, oh, that's the dumbest advice, Hillary. But maybe you're like me. I am the person that is like, I would love to be flexible for you if you can tell me when I need to be flexible, how I need to be flexible, and what I should expect from being flexible. I am that person. And if you are that person as well, I see you. I understand this. We're going to talk about how this applies to different areas of pregnancy, labor, birth. So I'm so glad that you're here. Let's talk about being flexible. And no, I'm not talking about that way, the way you got pregnant. I'm talking about other ways. Although I do love birth positions, if you're interested in information on birth positions, I'm going to put a link down below. The first one is to give up control. Now, there are so many things that I see people thinking that they can control online, and then I see them end up having their baby, and it's just so interesting to remind myself that I have no control. Now, Hillary, as a mom to teenagers and adult kids, this looks like giving up control with the cars. I've had to realize that they might get in an accident. I can do all of the things to try and teach them to be a good driver, but they might get in an accident, and I don't control that. So it's going to look like this through all of pregnancy, but giving up control in the labor room is realizing that if your body goes a little wonky, you might end up needing to be induced. You might end up needing a C-section, and ultimately you have no control over that. Now you're going to be like, Hillary, that is because the system makes us do this. And I'm here to say that our bodies make us do this. Mother Nature sometimes makes it so that you need to have something done that you weren't expecting. Now, that is not to say that you let your provider force you into something that you're not wanting. Make sure that you're always making the choice, but realize you don't have control. I gotta say, one of the other things that I really find amusing is the people who think they can control when they go into labor. There's so many people online giving the tips on how they went into labor, when in reality, it's their body deciding that it was time for them to go into labor. If you look at the studies, there's no magical equation to make your body go into labor other than the things that we do at the hospital to induce you. Those have been proven to induce you. But we ultimately don't have any control on when our body goes into labor. And I wish I would have sat around and ate more frozen yogurt and watched more TV and been kinder to myself as I was growing a full other complete human inside my body. I deserve that time to chill out. And be sure and make your partner watch that part of the video if you feel like you're not getting that at home. Fun fact, I see a lot of birth classes who sell "have the perfect birth" with their birth class. You'll never see that wording on my site because ultimately we don't control the type of birth that we end up having, because ultimately we don't always control these things that make a perfect birth. Also, I don't think there's a perfect birth out there. There's so many amazing, great births, and I hope you have one of those. But if you look at a class that's selling you a perfect birth, I would think, does this teacher really know what they're talking about? Because we can't sell that to you. Mother Nature has way too many spoons in our pots to sell that. Tell me down in the comments, how good are you at being flexible? I know that there are some of you out there that are amazing at being flexible. I am not one of those people. So toot your own horn if you're good about being flexible down in the comments. Or tell me if you're like me. I got you, girl. I see you. Okay, I'm a huge fan of birth plans, but let's switch the wording to birth preferences. You're learning what you would prefer if all the chips are falling correctly into the slots. Now, why do I like a birth plan? It's because I want you to think about what you would like to have happen in labor. I think that's important. I think that's awesome. I think there's so much gray area in medicine. There are a lot of times where we can both balance what's going on with your body and Mother Nature versus what you want at your delivery, and learning to balance those things is an art that we can learn. But when people get so tied to these birth plans, like it is what will happen, we're leaving flexibility out of the equation. And I don't think that's going to do you any favors. So ultimately, it's what would you like at your birth? And I think that's good to know. And then realize that it may not go that way, and that's okay, but you at least knew what you were kind of hoping for. And I think that's awesome. And I think that's awesome going forward. You're thinking today we're going to go to the playground, and you might end up going to the playground, or you might go and your baby's sick when you wake up. And so you don't go to the playground. But I think having a plan through all of motherhood and pregnancy is awesome, because we literally never would have gone to the playground if I hadn't tried to make that plan in advance. The final thing in being flexible is to learn how to get your options. Now, I talk about this a ton on my channel, and it's learning, again, to balance that gray area of what your doctor is seeing and what you want and how to balance those different things. And I want to assure you that you are not a bad person if your provider says, your baby looks a little bit big on the ultrasound. If you then say, hey, could we repeat that ultrasound again in a week, 3 days, and see how baby's growing then? Or what do you think when you place your hands on me? Does baby feel big to you? Because the more we feel bellies, fun parlor trick that we do in labor and delivery, I love to feel a belly and make a guess as to how big the baby is, and then see how big the baby is when they come out, because it's just a fun thing to do to kind of increase your skills as to when you lay hands on a patient, how big is that baby really in there? And providers know how to do that, but sometimes we don't get that information if we don't probe them about it. So it's definitely never a bad idea to find out your options. Could we get more testing? What happens if we wait? Could I make a decision on this in an hour after I talk with my partner? It's never a bad thing to find out your options, because in general, we're not emergently doing an induction. That's what we have C-sections for. And when your provider tells you the things that you kind of weren't expecting, the results from the ultrasound or your lab work or something like that, again, it's never wrong to go, oh man, I was really hoping for XYZ. I was hoping to go into labor naturally. Oh, I was hoping to use my cervical ripening methods, which I have a few if you want to check them out down below, for a little bit longer. And then having that conversation with your provider. Far too many people hear that the ultrasound's a little bit big, and your provider says, well, I recommend you probably get induced. And they just go, okay. And they feel forced into the induction, when in reality, they could recommend that you get induced. And you could say, hey, what would it be like if we waited another week? What would you see? Could we repeat the ultrasound? What do you think? There is so much gray area in labor and delivery, and I want you to be aware of that. We actually talk a ton about managing the gray area in the online prenatal class for couples, so I hope you'll join me in there. One of my catchphrases that I've been doing lately is educate yourself and then advocate for yourself. I think those are two things that you can really do that to still be flexible, but get the things that you're hoping for at your birth. Now, speaking of no control, I have a video on one of the things that we really cannot control, which is really annoying, and we're going to talk a little bit more about that. It seems like we have control over it, but we actually don't. I'm so glad you're here joining me at the Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.